So today's topic is international patient safety goals. Though this is not this isn't the infection control textbook, but this is a topic that everyone can benefit from, not just the infection control students, but everyone from all the other departments of quality control, Six Sigma, hospital administration. This topic can help you understand what are the international patient safety goals, okay, what we should focus on, what steps we can take to ensure that these goals are met, okay. So what is international patient safety goals? IPSG. They help accredited organizations, hospitals, address specific areas of concern in some of the most problematic areas of patient safety. Okay. So there is a patient safety awareness week as well. It's 12th to 18th March every year. So according to WHO, the absence of preventable harm to a patient during the process of healthcare and reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum. This is what we mean by patient safety, to reduce the unnecessary harm as much as possible and to avoid preventable harm as much as possible. Okay. So initially, the patient safety goals, there are 6 goals. These were first taken up by JCI. Okay. The first international patient safety goals were given by JCI, Joint Commission International. Okay. And from that JCAO's international patient safety goals, all the other nations and even the WHO took these goals and made it a universal standard. Okay. There are 6 key problematic areas identified by the Joint Commission on Accreditation of Healthcare Organization. So when you focus on these 6 goals, these 6 areas, and make sure you practice them every day, okay, you make the patient safety and patient outcomes much better for your organization. Okay, so these are the 6 goals. Goal 1 is to identify patients correctly. Goal 2 is to improve effective communication. Goal 3, improve the safety on high alert medication. Goal 4, ensure correct site, correct procedure, correct patient surgery. It's regarding the surgeries, safe surgery. Then goal 5 is reduce the risk of healthcare associated infections. Goal 6 is reduce the risk of patient harm resulting from falls. So these are the 6 international patient safety goals. We'll discuss each one of them in detail. So the first goal is identifying the patients correctly. Okay. Wrong patient errors are very common in hospitals. So therefore, the purpose of this goal is to identify individual as a person for whom you are giving your service or treatment. Okay. And it has to match the individual who is receiving it. Okay. So according to the Joint Commission International, they recommend that you have to use at least 2 identifiers. Okay. Name, date of birth, medical records, at least 2 of them has to be identified first. Okay. It could be either date of birth, patient number, okay, name, date of admission. These are different identifiers. So at least use 2 identifiers. Okay. Most commonly, what we use is full name of the patient and medical record number is used. Room number, location, bed number, these things should not be used. Okay. Before all invasive and diagnostic procedures, you have to use these 2 identifiers. But because patient identification errors can happen at any aspect of patient's journey, it is a very important step. And do not use patient's room numbers, location, bed numbers. Okay, wristbands for inpatient is used if the inpatient is not cooperative or they are not in a cognitive state of mind. So wristbands can be used to identify the patients. Second is improve effective communication standards. So you have to, this goal highlights the importance of effective communication. Okay, verbally communicating patient orders, or even if you're talking to your own peers regarding diagnosis or handovers of patients done when the duty changes. Okay, you have to ensure patient's data is communicated accurately, and it is also understood by whoever is receiving the information. Okay. So there are various aspects in communication. You have to share the floor. Everyone should be given time to speak. Okay. After you have mentioned your patient handover details, allow for the receiver to ask some doubts. Okay. So everyone should have time to speak. Keep focused. Okay. Don't stray away from the conversations. You have to keep your focus brief. Okay. Don't go into other conversations, other topics. Okay. Be focused in the given topic. Take care of yourself on what you need to say. Don't miss out on any points. Embrace differences. When you're talking with your patients, you may have an opinion, patient may have other opinion. Okay. So don't get agitated. Embrace the differences. Respect confidentiality. Okay. Whatever is shared between the patient and the healthcare workers should stay private. Avoid healthcare speak in public areas like in lift, corridors, where everyone else can overhear you. Be present. Okay. Your full attention should be given when somebody is speaking to you, like when you are receiving the patient handover or when you are getting communicated on the diagnostic reports. Be present. Okay. Don't be physically present, be mentally present to the communication. Know your stuff, do your homework so that you can actively contribute. Okay. Especially if you are a fresher, new student nurse or fresher nurse. Okay. You have to study properly the disease conditions of the patients whom you are catering to. Okay. Respect people's time. Don't make people wait to talk to you or to get an appointment. So next is goal 3, improving the safety on high alert medications. So the objective of this goal is to improve the patient safety while you are administering high alert medications. All medications can be dangerous when if it is used inappropriately, but especially when we talk about high alert medications, they have a more potential to cause harm that is likely to be more serious. And even if it is given in minor dose, it can lead to death as well. Okay. So to support the reduction of medication-related patient safety incidents, hospitals should maintain a list of what they consider as a high alert medication and make sure all the clinical staffs know what are these high alert medications. And they also have to have a process in place. Hospital should have a process in place to minimize the confusion around look alike and sound alike medications. Okay, usually these medications will show you a list of names. Okay, hospital should develop to manage the safe use of concentrated electrolytes like potassium chloride, potassium phosphate, sodium chloride, magnesium sulfate. Remove the concentrated electrolytes from the patient care unit and let the pharmacy prescribe it to you. Whenever electrolyte is supposed to be administered to a patient, let it come from the pharmacy so that you can avoid patient errors as much as possible. Okay. So these are the high alert medications. We use the mnemonic of A pinch. Okay, because of A pinch mnemonic, you can remember which all are the high alert medications. So all anti-infectives, antibiotics, antivirals, antifungals, they all come under this category. Okay, they are high alert medications. Potassium and other concentrated electrolytes. P stands for. I stands for insulins. N stands for narcotic drugs and any other sedatives. Okay. Then C stands for cytotoxic agents given during chemotherapy. Okay. H stands for heparin and other anticoagulant drugs. Okay. So these are the high alert medications. When a doctor has prescribed it, double check it and double check, identify the patient properly. Don't give the high alert medications by mistake to any other patient who is not prescribed on these. Okay. Then goal 4 is to ensure safe surgery. Significant patient injury and adverse events can result from wrong site, wrong procedure, wrong patient surgery. So these events can also occur from ineffective communication, lack of processes in place, lack of patient involvement when the site is being marked. Okay, patient should also tell this is not where the surgery is supposed to take place. It's actually here. Patient may also be scared and confused, they don't speak up. Okay, so this is an ongoing concern in many hospitals. Okay, to help minimize these adverse effects, uh, hospitals should use multiple strategies while identifying correct patient, correct procedure, correct site. Okay, because of this, WHO has also made this surgical safety checklist. Okay, using that checklist is also very helpful to ensure that these mistakes can be avoided. So we have a timeout surgery. You have to ask this question: is this the right patient? Do we have the right location? Are we doing the right procedure? The surgical team has to confirm with each other. Okay, they have to. Everyone should agree to the answer. So correct patient, correct procedure, correct site, and agreement that we all are set to go. All these steps. First of all, you have to identify, is it the correct patient who has arrived in the operation theater. Check the medical records, ask the patient 2, 3 times what their name, okay? Then confirm with the nurses, scrub nurses, that is the correct procedure, because they are ready with the kit, surgical kit. Okay. The third step is correct side and site has to be checked. Okay, which side of the patient or which side, is it right, left? Okay, that has to be checked. And then when these all first three steps have been agreed, it is correct. Okay, everyone has agreed to it. Then the surgery will start. The goal 5 is reduce the risk of healthcare associated infections. So effective infection prevention and control practices are very critical to reducing the spread of healthcare associated infection. This has been a major concern of patients and healthcare practitioners as well, particularly in the last 2 years during COVID-19 pandemic. Okay, a great importance was given on these strategies to prevent the spread of infection. The focus on this IPSG is on hand hygiene, and it requires hospital to adopt and implement an evidence-based hand hygiene guideline throughout the hospital to reduce the risk of hospital or healthcare associated infection. We are focusing a lot on hand hygiene first and foremost. Then comes the personal protective equipments, okay, environmental hygiene, cohorting the patient, screening the patient, test microbiological tests that you do, surveillance that you do, antibiotic stewardship, following the guidelines appropriate to specific infection, safety culture. Okay, but everything starts with something that is very simple but very important, that is hand hygiene. Okay, so these are the 7 main strategies to prevent healthcare associated infection. Hand hygiene has the biggest impact. So this is hand hygiene is the biggest circle here. The second is environmental hygiene. So your personal protective equipment and cleanliness of the environment, everything comes under environmental hygiene. Then screening and cohorting patients, especially the patients who are in high risk areas. Okay, patients who are on long-term antibiotics. Okay, patients who have suspected symptoms that they're showing, you have to screen them. Take the swab culture, blood culture. Okay, screen them, and all the patients who suffer from the same disease condition, they can be together in the same ward. Okay, don't mix the patients. Everyone suffering from the same infection can be kept together in the same ward. Okay, but don't mix two different infectious people together. Okay, then surveillance is done in high risk areas for patients who are put on ventilators, who have indwelling urinary catheter, whose surgery has been done recently within the past 48 hours, patients who have central line put inside them. Okay, any invasive devices are inside them, surveillance is done on them. You keep a close monitoring, you closely monitor these patients for specific signs and symptoms that can indicate there could be it is a start of a healthcare associated infection. So that is surveillance. Then antibiotic stewardship, there's a completely different topic. Okay, to control the abuse of antibiotics. Then following guidelines pertaining to what kind of infection the patient is carrying. Okay, contact prevention, droplet prevention, airborne transmission prevention. Okay, these things. So they all come under the patient safety culture. Excuse me. Then you have the goal 6, that is reducing the risk of patient harm resulting from falls. So falls are caused by a lot of injuries to patients. It can occur in both inpatient and outpatient settings. And there are multifactorial reasons as to why people are at risk of falls. For example, let's take healthcare setting. Beds don't have side rails, or it's a slippery floor. Toilets and bathrooms don't have handlebars on which the patient can grip onto. Okay, so that's the healthcare setting. Patient history: patients who are diagnosed with some deep ear infection or deep ear issues, cochlear implants. Okay, patients who are undergoing some delirious symptoms. Okay, they are don't have proper cognition, small and who are blind or visually impaired. Patients who are in a comatose situation. Okay, in all these situations, the patients in all these situations, the patients are already at the risk of falling. Okay, in all these situations, the patients are at the risk of falling. Okay, so the nurses should be aware of these. Okay, now, even if you're handing over the patient to the nurse who will be coming in the next shift of duties, you have to make them aware that so and so patient has been diagnosed with this disease condition which has the risk of fall. Okay, so the nurse who is coming or the doctor who is coming in the next duty, they're aware, they will keep an eye out for it. Okay, other things what you can do is you can use this yellow color badges. Okay, wrist badges which has a fall risk. Okay, so even if the patient is in comatose situation, patient can't speak, uh, the nurse on duty can understand that this patient is at a fall risk, and the side rails of their bed will always be put up. Okay, or you can mark them, ask like on the IV stand, you can place this badge, yellow badge, ask for help, don't fall, like that. And in pediatric wards also there is a risk of falls, but in pediatric wards, majority of the beds they come with side rails. Okay, so they already have a safety precautions, and use signages whenever it's a wet floor, cleaning is going on, where there's a chance of people slipping and tripping. Okay, use signages. And always protect the vulnerable patients, as mentioned earlier, such as certain disease conditions in which patient has a history of falling, like vertigo and all. Okay, so you have to do the risk assessment of the patient, at what risk do they carry of falling, and based on that you have to follow these safety measures. So in conclusion, the purpose of this six international patient safety goals is to promote specific improvements in patient safety. They highlight six problematic areas in healthcare and offer evidence-based solution to address each of these problems. And hospital infection control committee, they also they support the healthcare system in building quality and safety management systems to meet these specific requirements. And these requirements are given by JCI or any accreditation facility. Okay, not just JCI. Now NABH has also adopted the same goals. Okay, so you have to follow their guidelines, NABH guidelines, so that you can assist these goals, meeting these goals. Okay, so that's about for today's session.